In the heart of Southern Africa lies Botswana, a nation of rich landscapes and vibrant cultures. Today, we dive into the critical issue of healthcare funding in Botswana in a documentary titled Show Us the Money.
So Show Us the Money has come at an opportune time for our organization, Sintebale, but also for the country. We do a lot of advocacy work related to improving health outcomes for young people, particularly adolescent girls and young women. So Show Us the Money is literally exactly just that. We want to know where the funds that are invested for programming for young women are going, how they can be part of the process, and how they can also influence the decisions that are made affecting their health and their rights.
Join us as we unravel the challenges, aspirations, and the demand for transparency in healthcare budgeting through the eyes of Botswana's adolescents, girls, and young women, AGYW.
And I remember one time, most of our demand was around implants, and we had no implants, and that means we can't force young people to take a certain contraceptive that they would ideally were not there for, and that means they're going to return without the service that they needed, and that opens a lot of risks to a lot of things, your teenage pregnancies, contracting HIV and AIDS, because we have experienced stockouts of condoms as well. And during that period, we experienced a very, a slight increase on the number of new infections amongst adolescents and young women.
This documentary showcases AGYW actively engaging with policymakers, healthcare professionals, and community leaders.
The AGYW population group is a priority for the Global Fund. It's a priority for the country, and there's just the need for us to send a message out there to the AGYW group to say to them that there's funding available and you need to take charge. You need to determine how that funding is going to be used to help you achieve your health outcomes.
So we believe at Sintebale believe in meaningful engagement and participation of the young people that we work with. So we were very intentional about how we started the process. We wanted them to have an understanding of the concept, because when we talk about budgets, it sounds heavy. Money is not always easy to talk about. So just helping them understand the foundation of how the national budget works, how our health budget works, and just the ideas that they have, also looking at the gaps that they experience based on their reality. So we started with a series of workshops, foundational workshops, just to get a sense of what they know, what they understand. And our follow-up workshops were then used to build on the existing knowledge and to build their capacity. So we want them to be able to engage with leaders, we want them to be able to engage with their communities, being able to bring or build their capacity for them to have a better understanding.
AGYW are not just demanding change, they're driving it.
They should be, what should I call it, a bigger picture. They should be a bigger plan, because we still have a lot of youth. Despite having all of those things, there's still a gap that's there which needs to be addressed. So I need to see that. I want to see that be visibly, not just being said, because a lot of times we talk with no action. With the budget we see, okay, it is included, but where are the implementations? They're not there. Where are the projects? They're not there. We still have a huge gap when it comes to the youth.
As I have done this in different countries, and also having to be part of such movements in Botswana, I've been able to build a bridge for young women to be able to engage with local leaders at community level, at religious level, and even at parliament level. I'm talking of young women being able to communicate how they would want services to be given to them.
Yeah, it goes without saying. It's all out there that the more people are involved in terms of things that affect them, say for example, health issues. If you bring the people that are affected, if you bring the people that are more vulnerable than anybody else to come to the table, to be part of the decision making, It's a plus in that you don't have to do guesswork. You don't have to imagine what is it that this group wants. The group will be there at the table helping you make good decisions.
Thank you for joining us on this journey through the hearts and minds of the adolescents, girls, and young women in Botswana, demanding accountability and transparency in healthcare funding.